It often begins without warning, a crushing weight in the center of your chest. The sensation can be so sudden and intense that it stops you in your tracks, making it impossible to ignore. You might be going about your day, at work, at home, or even out with friends, when this overwhelming pressure hits. It's not just discomfort, it's a signal that something is seriously wrong. The pain doesn't always stay in your chest. It can radiate down your left arm, creep into your jaw, or shoot through your back. Sometimes it's a dull ache. Other times it's a sharp, stabbing pain. These symptoms can be confusing, making it hard to pinpoint what's happening, but they are classic warning signs that your heart is in distress, your breath shortens, a cold sweat breaks out, and fear takes over. You might feel like you can't get enough air, and your skin may become clammy. The anxiety that floods your mind isn't just emotional, it's your body's way of telling you that something is dangerously wrong. This is your body's alarm bell signaling a crisis in your heart. The heart, deprived of oxygen, sends out these distress signals in hopes you'll listen and act quickly. Medical professionals rely on these symptoms to diagnose a heart attack, and immediate attention can make all the difference. Every second counts. Hesitation can be deadly. The faster you seek help, the better your chances of survival and recovery. Time lost can mean heart muscle lost, so don't wait to see if the pain will pass. The feeling of impending doom is real, a physiological warning, not just anxiety. Many people describe a sense that something terrible is about to happen, a gut feeling that shouldn't be ignored. This is your body's way of urging you to get help immediately. The world blurs as your focus narrows to the struggle inside your chest. Your senses may become distorted, and it can feel like everything else fades away except the pain and fear. Dizziness, nausea, and overwhelming vulnerability set in. You may feel faint or even lose consciousness. These symptoms are your body's desperate plea for help, and they should never be dismissed. Recognizing these symptoms is the first step to survival. Knowing what to look for empowers you to act quickly, whether it's for yourself or someone you love. Education and awareness can save lives. Quick action can mean the difference between life and death. Don't hesitate. Call for emergency help at the first sign of trouble. Your body's alarm is there for a reason, to give you a fighting chance. The medical term for a heart attack is myocardial infarction, a phrase that might sound intimidating, but it simply describes a very real and urgent crisis within the heart. Myo refers to muscle, cardial to the heart, and infarction means tissue death due to lack of blood supply. So when doctors use this term, they're talking about the death of heart muscle caused by a sudden interruption in its blood flow. This means that a portion of the heart muscle is literally dying because it isn't getting the oxygen and nutrients it desperately needs. Without a steady supply of blood, the affected tissue begins to break down, and the damage can become permanent within minutes. The heart is a powerful organ, but it's also incredibly dependent on its own network of blood vessels, called the coronary arteries. These arteries wrap around the heart, delivering life-sustaining, oxygen-rich blood to every part of the muscle. When one of these arteries becomes blocked, often by a blood clot forming on a ruptured cholesterol plaque, blood flow is suddenly cut off. The heart muscle downstream from the blockage is starved of oxygen, and the cells begin to die. In these moments, every second counts. The longer the blockage remains, the more heart muscle is lost and the greater the risk of life-threatening complications. That's why rapid response and immediate medical attention are so critical. It's important to understand that a heart attack is not the same as cardiac arrest. While cardiac arrest is an electrical problem that causes the heart to stop beating suddenly, a heart attack is more like a plumbing issue, a blockage in the pipes that supply the heart muscle. During a heart attack, the heart may continue to beat, but a section of it is struggling and dying. This can lead to irregular heart rhythms, weakness, and even heart failure if not treated quickly. Emergency treatments, such as angioplasty to open the blocked artery or medications to dissolve the clot, are designed to restore blood flow as fast as possible. The goal is to save as much heart muscle as possible and prevent further damage. While the heart has some ability to heal, the muscle that dies during a heart attack is lost forever. Scar tissue forms in its place, which can weaken the heart's ability to pump and increase the risk of future problems. The intense pain or pressure you feel in your chest during a heart attack is your heart's way of signaling distress, a warning that something is seriously wrong and needs immediate attention. Recognizing these warning signs and understanding what's happening inside your body can make all the difference. Quick action can save your life or the life of someone you love. Remember, once the damage is done, it's permanent. That's why knowing the signs, seeking help fast, and taking steps to protect your heart health are absolutely vital. Heart attacks don't just happen out of the blue. They're the end result of a slow, silent process called atherosclerosis. This process can begin as early as childhood, quietly progressing for decades before any symptoms appear. Over time, the arteries that supply blood to your heart become a danger zone as they gradually fill with harmful substances. Plaque, made up of cholesterol, fats, calcium, and other substances, slowly accumulates along the inner walls of your arteries. This buildup doesn't happen overnight. It's a gradual process that can take years or even decades. As the plaque thickens, it narrows the arteries, making it harder for blood to flow freely. Certain risk factors can speed up this dangerous process. High cholesterol, high blood pressure, smoking, diabetes, obesity, and even chronic stress all contribute to the development of atherosclerosis. Genetics and age also play a role, but lifestyle choices are often the biggest drivers. Not all plaques are created equal. While many remain stable and don't cause immediate harm, some plaques are unstable or vulnerable. These are more likely to rupture, creating a sudden and serious threat to your heart's health. When a vulnerable plaque cracks or ruptures, your body tries to repair the damage by forming a blood clot. This is a natural healing response, but inside a narrowed artery, it can have devastating consequences. In arteries already narrowed by years of plaque buildup, even a small clot can completely block blood flow. This blockage prevents oxygen-rich blood from reaching parts of your heart muscle. Within just minutes, the heart muscle downstream from the blockage is starved of oxygen and nutrients. Without quick intervention, the affected tissue begins to die, leading to permanent damage. This is the moment when heart attack symptoms strike: sudden chest pain, shortness of breath, nausea, or pain radiating to the arm or jaw. These warning signs mean the heart is in crisis. The years of silent buildup have now erupted into a life-threatening emergency. Every second counts, and immediate medical attention is critical to save heart muscle and lives. The good news is that prevention is possible. Managing risk factors early through healthy eating, regular exercise, quitting smoking, and controlling blood pressure and cholesterol can dramatically reduce your risk. Recognizing the danger and taking action today can truly save your life and the lives of those you love. The classic sign is crushing chest pain, but symptoms can vary. Pain may radiate to arms, back, neck, jaw, or stomach. Shortness of breath, cold sweat, nausea, or dizziness are also warning signs. Women, the elderly, and people with diabetes often have subtle or silent symptoms: fatigue, confusion, or mild discomfort. Never ignore unusual symptoms, especially if you have risk factors. Silent heart attacks are just as deadly. Trust your instincts. If something feels wrong, seek help immediately. Early recognition is crucial for survival. At the hospital, an ECG quickly classifies heart attacks as STEMI or NSTEMI. STEMI means a major artery is completely blocked. Urgent action is needed to save heart muscle. NSTEMI means a partial blockage, still serious, but sometimes less extensive. Blood tests for troponin confirm heart muscle damage. STEMI patients need immediate artery opening procedures. NSTEMI patients are stabilized with medication, then evaluated for further treatment. Both types are emergencies requiring rapid care. The faster the response, the better the outcome. Diagnosis starts with an ECG to spot heart attack patterns. Blood tests for troponin reveal heart muscle injury. Doctors take a detailed history and perform a physical exam to rule out other causes. Imaging, like echocardiograms, shows how well the heart is pumping. The definitive test is coronary angiography, using dye and X-rays to pinpoint blockages. Every minute matters. Rapid diagnosis guides life-saving treatment. The process is streamlined for speed and accuracy. Teamwork in the ER is critical. Early intervention saves lives. The goal is to restore blood flow fast. For STEMI, angioplasty, PCI, is the gold standard. Balloon and stent open the blocked artery. If PCI isn't available, clot-busting drugs, thrombolytics, are used, but must be given quickly. STEMI patients may need medication first, then procedures. In complex cases, bypass surgery creates new routes for blood flow. Each treatment is tailored to the patient's needs and timing. Speed is everything. Time lost is heart muscle lost. Modern medicine has transformed survival rates. Immediate action saves lives and limits damage. Surviving a heart attack is just the start of recovery. Hospital care focuses on stabilizing and monitoring for complications like arrhythmias or heart failure. Cardiac rehabilitation helps rebuild strength and confidence. Rehab combines exercise, education, and emotional support. Medications prevent new clots, lower cholesterol, and reduce heart strain. Scar tissue forms where muscle died. The heart adapts, but function may be reduced. Emotional recovery is vital. Support groups and counseling help. The goal is not just survival, but a return to a full, active life. Ongoing care and lifestyle changes are essential. Prevention is the most powerful weapon against heart attacks. Eat a heart-healthy diet: fruits, vegetables, whole grains, lean proteins, and healthy fats. Exercise regularly. 150 minutes a week of moderate activity makes a difference. Quit smoking. Your risk drops dramatically, no matter your age. Manage blood pressure, cholesterol, and diabetes with your doctor's help. Know your numbers and get regular checkups. Listen to your body. Never ignore warning signs. Quick action saves lives if symptoms strike. Small, consistent changes add up to a healthier future. Protect your heart, for yourself and those you love.